Good morning, ladies and gentlemen. My name is Bud Mopper, and I've been asked by the AACD, the American Academy of Cosmetic Dentistry, to do a blended educational series on the multifaceted world of composite dentistry. It consists of 6 webinars, about 45 minutes in length, and these webinars will describe almost everything that I've ever done and that I do with the use of composite. It really will place emphasis on how composite fits into a restorative dental practice, how valuable it is, and then you can pick and choose where you want to use composite in your practice and how you want to use it. But we're going to show you so many things that you never dreamed that you could use composite for. And we're going to start out with our first webinar is going to concern itself with technique, and that's the technique of doing a Class 4 restoration. And we're going to show you how I think a Class 4 restoration should be done. That doesn't mean you have to do it my way, but it'll give you a concept of, at least, of how we can make the material disappear in the tooth structure each and every time. What we're trying to do is to show the attendee how you can get predictable, beautiful results every single time. So we're going to start out with a Class 4 restorative, and in doing so, I will explain, along with the technique, how I think each material fits into the bonding scenario. So if you take a look at this fracture, and you can see there's two fractures, the left lateral and the left central. And when we finish, I have not veneered those 2 teeth. I've just added the material to the tooth surface, and it's a completely invisible restoration. That is what you're trying to achieve. And that's what we want to do every single time, and we're going to show you how to do it. So we'll start out with this Class 4 restoration. We'll start out with the technique. Now, in order to do a restoration of this type, it takes a precise preparation. We'll show you the preparation we use, and if you've got something that's comparable, that's fine. But you do need to prepare the tooth adequately. That's number one. Secondly, you could use a stent to develop your lingual wall. I don't do that. I do prepare a lingual wall, however. I've always been able to do it by eye, and I always will be able to do it by eye. But if you need a stent in order to prepare the lingual wall, then I suggest you use it. Eventually, you're not going to use it for a single tooth because you're going to train your eye so that you can see the morphology, the proper morphology. Where people miss many times is not in color, it's in shape. And I personally think that shape and form are the most important aspect of creating the reality of tooth structure. And so I stress morphology tremendously, and you'll see how I do it through these series of webinars. In the case of the left central, we had the endodontist leave a post room, and then we were able, through the use of bonding in this case, do a very nice post to build up the core aspect of the tooth so that we could restore it. And as you notice, I'm etching it, I'm putting on the bonding agent, I'm using a copy of material and adding in increments. We build it up, we place it, tamp it to place, polymerize that, we do it in layers, and we continue, add more, and you build it up, and you can see how it's starting to come up towards the coronal aspect of the tooth. We add another increment, tamp it to place with our titanium coated instruments, because the titanium coated instruments are non-stick instruments, and in this case it was the use of microhybrid, and I would probably use microhybrid or a core paste to do this post. Whatever you're going to use to strengthen the tooth, at least use, whether it's a post or whether it's core paste or whether it's microhybrid, you want to make sure that it's a tooth colored material or clear material and not use a metal material in order to do that, because it's very hard to get the right color if you use metal. So once we're done with that, now we're ready to prepare both teeth. And you can see it's a very nice fill there, and that's the way it looks after we've completed it and we're ready to prepare it. All right, so in this case, we're going to show you the preparation. It's a very simple preparation. There's not much to it. And this is what's so nice about minimally invasive dentistry. I am not going to veneer this tooth completely. In fact, any place I can when I've got a Class 4 fracture, I'm never going to create a veneer. You could make a case even on the left side, you could veneer it, but I'm not going to. I'm going to blend this into tooth structure, and I think that's all you have to do. It's the process of how definite and how definitive your preparation is. You want to make the long bevel long enough so that you can retain that material on the two structure, but it's not just enough to make a bevel so that you can blend the material on the two surface. You want resistance and retention form, and what gives you that, and as you can see, the length of the long bevel. And I'm not going down where I interfere with the integrity of the free gingival margin, because I think the longer you can keep it in two healthy enamel, the better off you're going to be. On the lingual, here I'm using a 5856 brassard diamond, but today, more often than not, I use the pear-shaped diamonds to produce that lingual reduction, followed by a sort of a modified chamfer. And I'll take it along the same aspect of the long bevel of the on the facial surface. So if you take a look at it, that's our prep. And no matter how big or how large the fracture is, if you don't prepare the lingual, you will never retain the restoration. So the tiniest fracture that we have, I always prepare the lingual as well as the labial surface. That is, as far as I'm concerned, is key in maintaining these restorations. You can place any type of protective agent for etchant. I do not use retraction cord. That doesn't mean you don't have to use retraction cord. My partner uses retraction cord. I don't. I want healthy gingival tissue, and that's what we work to preserve, and that's what we're going to work on. If I got bleeding and things of that nature, I've got to control the bleeding. Maybe I'll have to use retraction cord. Maybe I'll have to use an astringent. In the picture on the left of your screen, you can see I've got a mylar strip around that tooth to protect for etching. You can use Teflon tape or any other protective agent to protect the adjacent tooth. We're going to acid etch it. Then we're going to use our bonding adhesive of choice. The bonding adhesive that I use today is a Cosmodent Complete. Now, what are we going to do next? We are going to produce the lingual wall. This is where material selection is key for me. You've got two choices, because what are you trying to do when you're producing the lingual wall? You want strength. Well, you can either use microhybrid or nanofill. They're both out there. They both work. In the case that you're going to see now, I used Renamel microhybrid, and we'll talk about the various aspects of these materials. There are different characteristics that separate these two materials, and we're going to try to show you that now. So if we take a look at it, microhybrid has the largest particle size of all the materials out there, okay? And because of the large particle size, it has the greatest strength, even greater than nanofill. It has more opacity. It's more opaque than nanofill, and it's more opaque than the other material we're going to talk about in a second. And those are great properties, because strength you need and opacity you need in order to stop shine through of undercolor, shine through of translucency that you don't want, and so that really helps. So microhybrid is effective. The microhybrid I'm going to use, and it's not true of all microhybrids, has excellent wetting properties, and yet it's very strong. And the reason that I love it is because it allows me to wet the surface and manipulate the material very easily, especially when I'm doing veneering and trying to block out large areas of color and bring color up and bring the opacity up and things of that nature, and change color rapidly from dark to light to the proper color that we're looking for. It's a great asset in that respect. A fault of that is that it has a little bit more slump than the other microhybrids. So we might have to put it on in a large fracture in a couple of increments. That is definitely a drawback. There's no doubt about that. As far as polishability, it has decreased polishability completely to a nanofill, and doesn't compare with the other material that we're going to use, the enamel surface, and I'll describe that in just a second. Okay? It does not paint polish long term. It's less wear resistant than any of the other materials that we're going to talk about today. It is more difficult to marginate when you're polishing, but it has less shrinkage than one of the materials we're going to talk about. But it does not have less shrinkage than nanofill. We're going to differentiate these two materials for you. It definitely has a less refractive and reflective index. For me, that's a big thing, and that's why it's not an aesthetic material. It is a material for buildup. It is a material for strength. It is a material that you can use in the posterior. Okay. Now, the other type of material you can use for the lingual wall is nanofill. Let's talk about it. It does have larger particles, but they're surrounded by minute particles. And there's only one pure nanofill material on the market, that is Filtech Supreme, and the others are nanohybrids. but they all have larger particles, and I'll show you that on SCMs. And what the larger particles do, even the Filtech Supreme, they have to aggregate the particles into a larger particle because they need the working properties. If you just used all nanoparticles, you could not work with it. You would be too sticky, you couldn't handle the material. So they need larger particles. That's for one thing. You also need the larger particles for strength. Okay? Nanofill has better handling properties in the respect of applying the material and it won't go anywhere. In other words, it has better handling properties, I think, than microhybrid does. Okay? It has similar strength to microhybrid, but not quite as strong. It is much more polishable than a microhybrid. It still does not maintain its polish long term, but it's a very polishable material. It has decreased shrinkage. In other words, it shrinks less than a microhybrid. But if you tease microhybrid down to the margin, its shrinkage is not that bad either. But if you're trying to close down a margin and you just can't quite get it, that's an asset for this material because it does, the shrinkage is decreased, and it's definitely an asset in posterior restorations because of its decreased shrinkage. It's easier to marginate because of its decreased shrinkage and because of its handling properties. It's very easy to sculpt down at the gingival margin. It is more stain and plaque resistant than the microhybrid because of its polishability. It has more biologically compatible than a microhybrid. It has an opacious translucent quality, and this is a word that I sort of made up. But what I mean by that is that it is opaque, but not as opaque as a microhybrid. It can be used in certain color changes, and when you want to bring up undercolor and things of that nature, they're lighter shade changes. But the translucent quality of it means that you're going to have to use something else that we're going to talk about, opacers, more with that layer than you will the microhybrid. Okay, and so in this instance, this is what you can do. The two instances you do the lingual wall. Now, in this particular technique, we are using the microhybrid because in the days when we did this, I didn't have the nanofill. Today, I would probably use the nanofill to build up the lingual wall because it's easier to apply. Okay, and it stays where you put it. And so I could put it on maybe in one increment. In this particular instance, because of I told you that our material of the wettability, it has a little bit of slump, you can put it on in in a larger fracture like this, it might take 2 increments. But we sculpted up over the lingual wall, and you can see in the right-hand side of your screen, you can see where I've already polymerized the first layer, and you can see the translucency of that material. Now, that's a very opaque material, but when you've got a large fracture there, the light refracts through it, and you've got to have some way to block it out. We're going to show you how to block that out in a second. So now we're adding the additional layer of microhybrid to complete the incised ledge portion. And this is just an example of what the nano would do in a larger fracture like this, is you put the nano on, you can put it on in one increment. It's against a darker tooth, so it looks more opaque, but it wouldn't be if it wasn't a darker tooth. But that's just the way it would look if you applied it. Okay? So once we're done sculpting and shaping this material, and you're going to ask, where do you put this material? How do you blend it? Well, I'm going to blend it along the long axis of that long bevel, so that when we bevel it back towards the edge, you're going to leave enough room so that you can add the material you need to do to complete your restoration. And if you look at that restoration and at polymerize, you can see that area of translucency and the differentiation between two surfaces. Now, how are we going to block that out? You've got that excess light shining through the restoration that shows the differentiation between the restorative and the two surface. And I see that many times when people come in because they don't use what we're going to use right now, and we're going to show you that. What we're going to use is a series of materials called opacers, and the opaquing system that we use, a creative color, that's from Cosmodent, and we're going to block that shine throughout. Now, before we start this one, if you look on that restoration, there's an area of roughness. And before you start something like that, I would take it and smooth that off. The smoother you can make that, the better you are. And if you do that, if you've touched that area, you must clean it off, acid etch it, and put on bonding adhesive, okay, prior to the application of anything else. and then you'll get a great result. And let's talk about what opacers should do, okay? It should produce opacity while color blending at the same time. What does that mean? That means you need a series of opacers where the color matches the material and matches the true structure that you're doing. Most opaquing systems don't do that. In fact, the only one I know that does that is the one we're talking about today. Okay? It should block light transmission and the excessive translucency, and also the undercolor any undercolor that you see in there. We're going to talk about this throughout our presentations as we go along. They are value increasers. If you want to increase the value of something, you take the opaquer of choice of the color you're using and you place that gingerly and slowly, and you'll gradually see the value increase to where you want it perfectly, and without over excessive opaquing, because this opaquer increases value in real thin layers. And it's used to mask dark areas of all kinds, whether it be the one we're working on, which is a hypertranslucent area, or metal, or unsightly color, anything you want. You're going to see that throughout all these presentations. And they should be used sparingly. That means that when you use them, you should use them what I call gingerly, and you'll see it being used off the tip of the brush. Where are you going to start this opaquer? You're going to start it on the middle of the bevel, never past the end of the bevel, and you want it on the bevel so that you get a perfect blend from restoration to tooth structure. If you put it too high, you might be able to see the opaquer. So it's got to be on the middle of the bevel and then blended towards the defective area. And what are they for? It's to help create invisibility. That's my whole premise of bonding. You don't want to create a filling, whether it's a class 4 or class 5 in the size or whatever it is, okay? You want to create an invisible restoration. You want to recreate the life of the tooth. And you can do it without over preparation. That's the beauty of minimally invasive dentistry, and that's the beauty of the technique I'm going to show you. So, here we are opaquing, and I started on the middle of the bevel, and you can see that material on the end of the brush, okay? And then I'll start to just smooth it off. And what I did is I started on the middle of that bevel and brought it down towards the incisal edge, and then I took the brush and sort of just flattened it off. And you can take these brushes. Brushes we use are also Cosmodent brushes. There are all kinds of brushes out there that you can use. You use the brush of your choice. These are very nice brushes. And what's nice about them is that they don't leave streaks or scratches. They're a synthetic fiber, and they're wonderful to use. And you can shape them any way you want once you prime the brush. But we go ahead. So if you take a look, you can see how we use it off the tip of the brush and gently blend it from the beveled area towards the incisal so that we get a uniform look, taking it from an area where you can see that translucency to an area where the translucency is blocked out. Now granted, you've got some hypoplasia in that tooth structure, and we're not going to try and replicate that. In fact, it's going to be gone when you see it, when we finish it, and you'll see it a year later, okay? But if you look at the incisal edge, you can see translucency at that incisal edge. Now, I didn't produce that. All I did was leave those translucent areas to try and replicate translucency. If I didn't have that translucency, then I would use tints, which we're going to discuss later on in these presentations. I would use tints to create that translucency if I'm trying to mimic other teeth that had translucency. If the other tooth didn't have any translucency, I wouldn't try to mimic it. In this case, I let the underlying translucency of the composite and of the tooth structure over on the right side do the translucent aspect for me. And that's what opacers will do for you. Now, our next layer is the enamel layer. Well, in most systems, they're going to do it. They're going to use nanofill. And here we are. This is what nanofill looks like. But when we're talking about the enamel layer for Bud Mopper, and for any Cosmodent user, I think, we're talking about microfill. Why microfill? Because it's the only composite material on the market that truly replicates the enamel surface. And as far as I'm concerned, it's the only material in dentistry that can truly replicate the enamel surface. So let's talk about its characteristics and compare it with Nanofill, and then you compare all these, go back and compare all these materials with one another and see what they bring to your format. Number one, it has a smaller uniform particle size. No, the particles are not smaller than Nanofill, but they have a uniform particle size of 0.04, and they are spherical particles. When you go back through the history of these materials, the material that was first developed, which came first? The chicken or the egg? Which came first? Microfill came first. Which came second? Microhybrid. Why microhybrid? Because they were trying to do a universal material that would replicate everything. It didn't work. Couldn't replace microfill as the enamel layer. Then came Nanofill. Nanofill got rid of a lot of the defects that aesthetically that microhybrid had, okay, but it will not replicate the enamel layer like microfill. And in handling, there's no product. Even though the nanofills handle beautifully, there's not a product in the market that handles like microfill. Everybody tries to replicate that, and it's very difficult to do. It's so easy to place and sculpt and shape, and doesn't slump. You take it where you want to. It's just an amazing handling properties. Has increased polishability over any other material in the market, more than Nanofill, and it holds its polish over long term, whereas the others will not. And I'm talking not about 2 years, 5 years, 15 years, like you get 20 and 30 years. And we know that, and I got the results. Microfill is a superior material when it comes to long-term polish. It's easier to marginate. In other words, that doesn't mean it's easier to get it to the margin, and because of its sculptability. But you need to know that down at the gingival margin, if you're doing something in all microfill, then you're going to have to do something special in order to close that margin, because it does shrink more than the other two. Okay, it is more stain and plaque resistant than any material on the market. I think it's unbelievable. When it's polished properly and marginated properly, it's incredible material. And what's amazing about the materials that we use is the color stability is unsurpassed. And it's the only material I know that has this aspect to it. It is more biologically compatible than any material on the market. It has better wear resistance. In other words, which one wears better? Well, the one that wears the most is microhybrid. The one that wears the second most is Nanofill. The one that hardly wears at all, if it wears, is microfill. That is because of its particle size and its superior handling and the spherical particle. And it has a better refractive and reflective index than anything. And that has to do with the way it scatters light. It has to do with the way it maintains its polishability. It has to do with the way of its color integrity. And that's why it mimics enamel so beautifully. And that's why throughout the years, even though our microfill is 27 years old now, it's just the results are unreal over time. And we're going to show you that. And it has a more realistic translucency. Let's talk about that for a second. The other materials do not have the translucency of microfill. There is some opacity in the microfill. One of the wraps on microfill, besides the fact that it chipped, okay, in the old days, was the fact that it was too translucent. But this microfill that we developed has opacity in it. So it really replicates the natural opacity, because there is some opacity in the enamel. Enamel is not completely translucent. It is opacious. It lets things shine through, and there's no doubt about it. But it's not colors completely. And so what we've done is we've developed the color that we want for each enamel surface, and the thing that happens is that because of its translucency, it will let things shine through that you want it to shine through. That's why with our system, and with the concept that I developed and the way I think it should be done, is that we can develop color within. And the reason we can develop color within, like the natural tooth surface is because it'll let tint shine through this more realistic, transparent, and translucent surface. So we take a look after the material selection, and this will describe the enamel layer for you. If we take a look at the SCMs, of polished surfaces of different materials. This is Filtech Supreme. You can see there's lots of small particles, there's bigger particles in there, and there's particles you can't even see in Filtech Supreme that don't even pick up. So there's nanoparticles. Some of them are 0.00, 0.25, some are small. Listen, anything that's smaller than zero point 0.1 microns is a nanoparticle. So there's all kinds of nanoparticles in there. And then there are these aggregated particles that go to give it strength and the integrity and the ability to handle it. That's an SCM of Filtech Supreme polished at 1,000. Okay? This is Cosmodent Enamel Nano. Now, hey, it's a completely different type of material. The larger particles in there, which are black, which has just a refractive index, has nothing to do. It's not that the color is not black. That's the way it comes through. But those are hybrid particles. Down in the corner, you see that particle with larger. That's an agglomerated piece of material. Okay, and that's microfill. And then there's little pieces of microfill, and there are nanoparticles in there. So the darker particles are the microhybrid. The larger particles that are lighter but with particles in them are similar to the aggregated particles in the Filtech Supreme. That's microfill particles that have been pre-polymerized and then put into the material. And the smaller, larger particles are still the agglomerated portion of microfill. Then there's microfill in there and nanoparticles in there. Now if you take a look at Curve Premise, it's an all hybrid system, okay? And there are all different sizes of hybrid going down to, I don't know, 0.02, and they're ground up and maybe even go finer. And they've got nanoparticles in there besides their 0.02, and then they've got agglomerated portions of which gives them larger particles in order to give them workability. So every system is the same in essence. They need small particles and large particles to make it work. Now, if we take a look at enamel microfill polished at 1,000, it's a completely different look because it's like looking through glass. That's the transparency of it, okay? And that's the difference between microfill and these other materials I'm talking about. That is why I say you want to replicate enamel, this is the thing. Now we're talking here physical properties. We haven't even talked color yet. And color is a whole different animal from where I come from. And so we're going to discuss that later on. Okay. And this study was compiled by Dr. Anna Russo at the University of Illinois in February 2009. You can call her. You can ask her. She's doing continuing studies on our material and other materials all the time. She's a great researcher. So, if that's the case, and microfill is my layer of choice to create the enamel surface, I'm going to use microfill. And you notice I place it on in a larger increment. You can roll it in your fingers. You can touch it with your fingers. In fact, all these materials you can touch with your fingers. A lot of people will only use instruments. Bud Mopper uses his finger in order to manipulate it. If you're going to do it, you want clean, dry gloves. You want to make sure that the patient doesn't have any makeup on or mascara on, so that you don't get anything on your gloves. You want to make sure anything, if it's been polished, you don't want to aerosol on your gloves, but you can touch this stuff with your fingers if you want, or you can use instrumentation like we're using here. These are all our titanium coated instruments. When we do it, we're going to sculpt this material from the facial as close as we can get it. We'll leave it only slightly overbulked, but from the proximals, we're going to sculpt it exactly like we want it. And I think sculpting is one of the key things in doing this dentistry the right way. If you put the material on and don't pay any attention to the shape and form, you are going to end up having a big problem polishing it and getting the shape you want. If you pay attention to the shape and form, it's going to be a lot easier for you. And so if anybody were to ask me what's the most important aspect of the whole thing that we're talking about, I would say the application and sculpting of the material. And in this last one, you can see I've even shaped the mamelons. I've got a central groove. And this is not polymerized. This is unpolymerized material. And that's the beauty of microfill. It holds its shape, its form. And you can see the translucency shining through this material prior to polymerization. And that is done with both the 8A and the IPC instruments. We have long-bladed, short-bladed, off-angled instruments that you can use. And also the IPC instruments are used to finitely sculpt the material into the interproximal areas and close down all margins and do the things that you need to do in order to make it beautiful. So once you're done with that, you polymerize it. And what we usually do is we add each layer in 20-second increments, and then our final polymerization is done for 60 seconds, and we usually polymerize from both the labial and the lingual. So I'd rather over-plumerize than under-plumerize. Now, the next thing you do is you're going to finish and polish. And we have a whole concept on finishing and polishing. And that, again, it's an art and a science. The science of it is it takes the right instrumentation in order to get a great polish. And the art is in the skill of the operator in creating that polish. Now, I'm starting out this reduction with the use of two things, either the discs or the ET system. And I use Brass's ET system, and the polishing system I use is Flexi system from Cosmodent. In this particular instance, I've shortened the incisal edge prior to anything else to get to where it should be, and then I go to the ET burr to contour it. Now, if you take a look at the way we contour, when you're contouring, you're trying to make a straight burr make a curved surface. You can't do that if you're on the burr straight on the surface. When I'm trimming on the incisal edge, okay, towards the incisal edge, I'm going to use the top portion of that burr, the broader portion of the burr. As we go down towards the center of the tooth, then we will rotate it, and that's where your wrist comes in, your motion. And I must impress upon you that high speed is a killer. So running at anything over 30 to 40,000 with these burrs is bad news, and you want to have control. So I never polish anything at more than 30 or 40,000 RPMs when I'm using even a high-speed handpiece. In my case, I'm using an electric handpiece. As you go towards the gingival, you're going to rotate it towards the gingival, and the burr is away from the surface of the tooth. That's how you make a straight burr produce a curved surface. And I'm taking it towards the gingival margin. Maybe I won't even go underneath that margin. I'll show you in our technique how we get underneath that free margin if we have to go underneath the free margin. This is just showing you how we would do this. Okay? So here we are. You watch, I'm down towards the tip of the burr. You watch the burr motion. As I bring it towards the center, I'm up in the center. On the lingual, we'll use a pear-shaped burr. This is the OS1 burr because it follows the concavities of the tooth. And if you watch it, you're blending it towards the incisal, down towards the gingival, and you want to end up with no exposed margin. And that's the way you're going to get the best polishability and best retention of the material. And that's what you're attempting to do. And the patient, believe me, if you have a margin that's raised, and the patient will always feel it, and they'll tell it to you. You want to get that surface polished beautifully, and if it goes into grooves in there, then you want to make sure you polish into a groove, because the patient can ascertain every aspect of how that tooth should feel. And this burr will do it for you. Now we're transferring to the labial again, and we're going to refine the labial surface with a 16-fluted burr, running it much the same way that we told you before. As you tip it towards the incisor, you're going to use the wider portion. In the center of the tooth surface, you're going to be cutting it on middle portion. As you tip it towards the gingival, you're going to be cutting at the tip of that burr, and the burr is going to be laid away from that tooth. That's the way it works. And if you really want to get a nice polish, you run this down to about 3,000 RPMs and run it over the surface of the tooth, and it will put a sort of a gloss on the tooth, and it will get rid of any defects and striations that you want in it prior to doing your final finishing and polishing. Now, the use of discs are very important, believe me. I'm refining the margin towards the gingival, and so you can see the way I've got that disc placed. I've got it flipped so that the cutting edge is on the internal portion of the disc, and I'm cutting down from the restoration to the tooth surface. That's always the way you want to go, from restoration to tooth surface, so that you blend that margin into. You don't want to go the other way because you'll end up undercutting and ledging the material. So, and use the flex of the disc. You'll see throughout this presentation that flex, and that's why it's called Flexi disc. And what's neat about this disc is the resilience of the paper because it snaps back, it doesn't crimp, and again, you're running it on speeds no more than 15,000 RPMs. You don't have to run it at 30,000 RPMs, but you run it at about 10 to 15,000 RPMs, and even slower when you use the coarse, okay? So, and here I'm using medium. I might have started with coarse at the incisal. I may have used coarse to round out the proximal. The coarse disc is key in many instances, and I'm going to tell you where. Okay. Now, as you see, as I run it towards the gingival portion, I can also flex it. We can run that. This is a big disc, and we've got 3/8 disc that you can run right underneath the gingival. You won't even find it. But you want to flex that disc, and you're running it the same way. You can also flip the disc on the labial surface and use it on the labial surface. So the disc is, even though it doesn't cut on two sides, you can flip it to cut on any side you want. And as you do the interproximal, this is imperative. Again, it's from the interproximal to tooth surface. You never refine the line angles from the center of the tooth into the line angle, into the embrasure space, because that's the way you're going to lose incisal edge thickness and the integrity of your contact. And you're going to make it more like a chiclet. What makes a tooth look like a chiclet is the shaping, not the color. You want to make this look like a tooth. Remember, each tooth stands out by itself. Each tooth has proximal contact areas, not proximal contact points. And so what we do is we always drive it directly into the contact point, having it parallel with the line angles and the embrasure space, and actually perpendicular to the tissue, and then flex it over the line angle. And you do that at about 10,000 RPMs, and you'll get unbelievable embrasure spaces and contact areas. So now we're going to refine our polishing even more. We're going to use rubber cups, of course, on the lingual, because you can either use a wheel or cups or points. In this case, we're using a rubber cup. You can use the medium to start and finish up with the superfine. Here we're using the cups on the labial. We never run it on the exposed margin, only on the material, okay? And we run it under copious amounts of water. You can see the water being sprayed on the tooth. You can either use a water drop or water spray. Here we're using the points to refine our grooves so that we retain our grooves, but they're a blend. They're not lines drawn in the material. They're undulating surfaces, undulating angles from one surface to another, which will produce beautiful lobes that you're looking for. So that when we get done, this is what we're looking for. We're looking for an invisible restoration. That is a restoration, folks. That is material blended into tooth surface. That is not a veneer. And whether we have it with the color in it or take the color out of it, you can see the translucence in that material. All the way from incisal to gingival. You can see the subtle translucency at the incisal. You can even see a hint of a halo in that. Just a hint. Okay, and that's the way it looks when we finish. If we look at it a year later, I did not put hypoplasia, did not mimic the hypoplasia. We can, and we'll try to get into this in later webinars. But if you take a look at that from incisal to gingival, you can see what we've got. And the translucency is still there. There's no ledging. Okay, and you can't quite see that. You can see a hint of the anatomy, but believe me, it's the camera angle, and I'm much more sophisticated taking pictures than I was in those days. But if we take a look at it from profile or from the occlusal, you can see that the characterization is there. And if you take a look at it from profile, you can see that the characterization is there. The only thing I didn't put in was the horizontal striations, like the pericomata and things like that. But this is dry. You'll not see that. The reason I don't do that primarily is because when it's wet, you don't see it. So I could do it, and there are other people that do that, and they do it very well. But that's the way you do a class 4. Now, for a second, let's talk color before I go into the second class 4. All right. With the enamel restorative system, we told you that the system that I use is a little bit different than other systems, and the way we use it differently, because I believe there's a place for each and every one of these materials to shine. Okay? Also in color, in order to understand color, let's talk about the most common procedure being used today and oppose it or put it in juxtaposition to the color system that I think works much easier and is simpler, and will give you more consistently reliable results. The most common procedure is, let's say you've got an A1 tooth, or any color tooth, doesn't make a difference. This particular is A1. They use as the buildup material, and they're going to use as their lingual wall, they're going to use a dentin material, which is either a microhybrid or a nano system, and it's going to be dentin colored. It's going to be a color of dentin, okay? And that's the way they're going to describe it, and they'll call it A1 dentin or whatever it is, but that's what they're going to use, okay? They're going to overlay it with a microhybrid or a nano, and lots of times you're going to see a differentiation between that material because they're not color coordinated to one another. They just aren't. And most systems are not. And so what you'll see is you might not see it when they walk out. Maybe you'll get it right sometimes. But I want you to get it right every time. Okay, not sometimes. And so I don't want to see when they come back the differentiation between the incisal fracture and the tooth surface. So I see it differently again. Okay, I see colors differently. I say let's keep it simple. Okay, because what they're trying to do is get your color internally and then let it reflect through an overlying compensatory color and come up with a third color. That's not the way I see it. Not to keep it simple. I say, hey, let's take the shade that we're looking at, that's A1, and build to the external shade, not build through the internal shade to the external shade. I'm saying build completely to the external shade. So what I see it as is, hey, I want an A1 microhybrid or nano to build that incisal edge. I'm going to put it on there. You saw I got some translucency, okay? But the color is exactly A1. Only the opacity is different. So it needs more opaquing. Now, not always that happens, because in the next case you're going to see where the nano did it, but because there's a lighter color change. But most of the time, I'm going to have some translucency there. How am I going to get rid of that? Well, the way to get rid of it, simply and fast, okay, is to use an opaquer. In this case, it's an A1, which goes with the A1, which is exactly what I did with the other tooth, which was I think it was an A3, and it went to the A3. So now I use an A1 opaquer. It's the same color of the material, only the opacity is different. So now we've got our A1. So what's next in the formula? What do I need to finish it up? I've got my lingual wall. It disappears. What do I put over it? Microfill. What color? A1. So anytime you got a fracture, if it's an A3, it's A3, 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 and that's it. You got one tooth against an arch, and the arch is A1, and your tooth is gray. You want to bring that lower layer up to an A1 and then overlay it with an A1 microfill, and you're home free. So it works either with your veneering or when you're fixing a piece of a tooth against itself. Okay? So, and the secret to this is that the microhybrids, the microfills, the nanofills, and the opaquers have been exactly color coordinated to each other on the money and a selected shade guide, which in our case is the Vita shade guide. And if you look at it, we're probably the only one that completely matches the Vita shade guide on the money. Why? Because that allows us to marry porcelain with composite and composite to two-structure to porcelain. And so we've always been with the Vita shade guide. That's the one we've tried to mimic all the way through our system. So this is a secret to the entire aspect of selecting shade. So selecting shade is not a difficult thing to do. The only thing is, you got to be able to take the shade. I suggest that for shade, you use different lighting. I use the overhead light in my operatory, which are color-corrected lights. That's the best place to take a shade. We also will look at it under a color-modified light, which is made by Adent, which is a wonderful light. Those are the two lights I take it in. I don't use natural light because that bleeds out all the color. So this is Renown Restorative Systems' method of developing color and matching color, and I think it's the simplest, easiest method. My whole thing is that bonding's been made too difficult, and I want to make it easy, and I think these techniques make it easy. In addition, a good system should include incisal shades and matching flowable shades, and that's what Renewal's restorative system has in both the composites, in both the microhybrid and the microfill and the nanofills. And so this is what we're looking for. And it's this complete system that works, and it gives us a cookbook for success. So that's our first webinar, and I've got 4 more to do with you, and you're going to have a wonderful presenter, Dr. Dennis Hartley, who is a tremendous practitioner in his own right, show you his technique for using doing posterior composite. And this sort of sets up the premise by which I do everything. And you will see a lot of it's redundant. A lot of what we do is redundancy, but you'll see it almost all the way down the line that it's a system, and it's a system that works repetitively and consistently, and that's what you want. You want to simplify bonding. You want to make it easy to do your practice. You want to make it enjoyable. You want to be refreshed when you walk out of your office and when you do these cases, and that's what it's all about for me, because the techniques that I've worked with all these years and developed, and the system I work with is what makes dentistry so wonderful for Bud Mobley. So I enjoyed it today. I hope you continue to follow me along on the other webinars.